The first thing you can do at home, if you start to develop pain in the back of your heel, which is the most common symptom, and swelling can also occur as well, if you start to develop those symptoms, the first thing to do is to cease the activity that you feel has caused that to develop. If you've been recently increasing your running distance or the intensity of your sports activities, then you should certainly back off and slow down until the pain is resolved, or at least go to a level of activity that doesn't aggravate the pain. The second thing to do is to consider RICE, which we've discussed before, with rest, ice, compression, and elevation. All of these things can help to reduce the pain. Anti-inflammatories can help as well, and again, Motrin or Aleve or naproxen are good examples of medications that can help to reduce that pain. One of the things that can help at home that you can do before you see a physician for this, though, besides rest, would be to consider putting a lift in the heel of your shoe or going to shoes that have about a 1/2 of an inch lift, because just tilting that foot forward like that will actually decrease some of the tension on the Achilles, and it'll also reduce the pressure that happens from the back of the bone pushing against the tendon, which is one of the reasons that this occurs. So going to a little bit of a heel lift over the course of several weeks can help this. If pain persists longer than about 2 months, then I think that's an appropriate time for you to seek treatment through your foot doctor.